The next speaker, Dr. Arup Chakrabarti. Arup Chakrabarti, I hope everyone knows him. And he is a person originally from that Arvind Hospital. He was a mentor, trainer for cataract training, IOL training for several years. So several ophthalmologists. And I would request all the speakers to be please present till the end of the session. After they finish their talk also, then please stay back for other speakers' sake. Thank you very much. So Dr. Arup would be talking on decades as a Phaco.
Thanks a lot, Sanjeev, for the very kind introduction. Today we are witnessing an explosion in knowledge. Every other day some new technique comes up, new technology, new molecule, new way of doing things. So I am going to share with you how I have adapted to this knowledge explosion, and it is incumbent upon all of us to move with the times, to ride the wave so that we stay current, and the benefits of all this new knowledge, new technology and everything is passed on to the patient. So this is just an extract of how I have adapted to the situation. Earlier on, of course, whenever I used to travel, I read, it was the physical textbooks, journals. There are a lot of expenses involved in acquiring those textbooks and journal articles and all. So today, 99% of all my knowledge acquisition studies take place through these websites. AIOS.org. It houses a wealth of information. AO.org, ONE Network, iWiki.org, Cybersite.org, iConnectInternational.com, ESARS.org, ASARS.org. These are the sites I visit almost on a daily basis. So I will start off with AO.org because this is one of the most complete websites that I have ever accessed in ophthalmology. So it has a chapter, it has a section for the ophthalmologists, for the people who are engaged in advocacy, and for the public and the patients. Now, as regards the ophthalmologist, if you see this particular bar, it gives you a plethora of information. Let's say clinical education. For example, when I go to that, I go to the journals, and you have access to more than 20 journals. So you don't really have to subscribe to some of these prestigious journals like American Journal of Ophthalmology, then ophthalmology retina, ophthalmology glaucoma, and so on and so forth. So I mean, you just need to be a member of American Academy of Ophthalmology, $400 per year. It has gone up over the years, but I think it's still a very nominal amount, and you get any article that you want immediately using your membership details. And then second thing, of course, they conduct a lot of pertinent clinical webinars and courses. As a member, you don't have to register for it, and these are all archived. So most of the controversial topics that we talk about, and some of the popular ones, if you want to see what is the evidence-based discussion done by the experts in the field, global leaders in the field, you can look them up in the courses. Focal points have stopped now, but the archives are available, the clinical webinars. What I find extremely useful was, when COVID came in, so WHO had come up with the guidelines. American Academy guidelines on COVID-19 was something unbelievable. They're so up to date. AIOS also was not lagging behind. Then preferred practice pattern. Some of these common disorders, evidence-based practice, it's not, we should not be saying, in my experience, it has, this medicine has worked well or that lens has worked well. You need to have a preferred practice pattern which is evidence-based and adapt it to suit your own practice. Likewise, ophthalmology technology assessment, newer technology that comes up, in what is the relevance, whether just research tools or whether they have practical implications in your day-to-day practice. And then there was a lot of discussion on premium IOLs. This is about 2 or 3 years old, this particular section that came up. So you get current literature, even the FDA report, everything. You don't have to depend upon the sponsored talks by speakers or the company executives, company representatives. And then there's a multimedia library, all sorts of videos. You just search in the keyword and it shows up. There are different formats, 1-minute format and the longer formats. Everything is there. And then a bit about ONE Network. ONE Network was, it is Ophthalmic News and Education Network. Now, as a member, I get full access to it. But I think about 1 or 2 years back, AO had a tie-up with AIOS where many organizations like AIOS had free access to the ONE network. Somehow it has been withdrawn, and I sincerely hope that AIS membership, AIS leadership takes it up seriously, so that about 26,000 Indian ophthalmologists, just through the AIS membership, can access all the benefits that I have been talking about. And there is also an option, like if your society is not registered, you can individually write to this email address, your circumstances, you are a teacher or whatever it is, financial issues. So it is also made complimentary. I have come across some people in Africa, when I go for the academic meetings, who access it without becoming member of the American Academy of Ophthalmology. So this is basically what the ONE network does. I'm not going to, elaborate on that, what I've already discussed. Second thing that is extremely useful is iwiki.org. Now, if I'm presenting on something new topic, sometimes it happens that, not my field of expertise for the last couple of years, but still I want to present something. So this is something which is absolutely up to date. This is a collaboration with an American academy and more than a dozen societies. And it keeps on changing. And it doesn't give you the very latest in details, but you get an overall idea as to what is happening, and then there's a bibliography. So then you can look up the cross references. That in 2 or 3 days' time, in a particular section, you should be able to make your own presentation on that. So it is extremely useful. Then the ICO, their website, cybersite.org, they have very frequent webinars. So all these lectures, surgical videos, quizzes, manuals, and what I really look forward to is their webinars. And sometimes, these webinars, like when I'm traveling and I'm not able to attend it live. So I've created a subfolder in my email. So they send the recorded version. So I save it in the recorded version. And whenever I get the time or when the interest up, the need for that arises, I look it up. And this is all recorded. So for example, a couple of years back, a lot of formulas have been coming up. If you see now, there are about 30, 40 formulas in addition to Barrett or, the Hills RBA formula and Kane formula. So a lot of formulas have come up. So it gives a very good review about, how to go about confronting those formulas. So then the AACRS used to have a very vibrant, very energetic discussion forum. And can I take a little more?
Yes, please,
time?
please.
Yeah, thank you. So, it was a very vibrant forum, and people used to come up. I had a problem with this particular lens, with this machine, and very frank discussions. But then AACRS, like many organizations, are heavily sponsored by these multinational giants. So those speakers used to be blacklisted. Some of them will be ejected out. So now a group of people, they got together, made iConnect International, and it is of course sponsored by a few companies, but it's a free for all. You maintain, of course, the personal dignity and respect for each other, but you can post anything clinical complications that you've had your experiences, so on and so forth. So, for example, now there's a discussion was happening on IC8, the new lens, the small aperture lens, yak capsulotomies. How do you do it? Yak capsulotomy. So, like that, I again create a subfolder whenever I'm not able to come online when the program is going on. I created a folder, and now see when I have a time. So, for example, this particular discussion, which is current now, is Johnson & Johnson has discontinued a particular type of very popular lens in USA, which is still used in India. Astigmatism, accuracy of diagnostic, machines. So basically, you have the leaders, the world leaders talking about their own experience. You have, Warren Hill participating from this side, Graham Barrett is participating, and everybody. You get to know it's sort of not a one-to-one discussion, but it is a very useful discussion that happens. And of course, I wrote edited 3 books that are available online also. So then another important information I would like to give you is our AIS proceedings website. From 2017 onwards, all the deliberations, most of the presentations have been captured. They have been put up in the website. I started it off. Initially, there was a lot of opposition from the home front, unfortunately, but all those I could tackle, with a lot of perseverance and, with negotiations and things like that. But now it has become a reality. So yesterday also I was talking to one of the cornea experts. He is telling, Arup, it was so useful. When I want to preparing a talk or want to have some doubts clarified, I use a particular keyword which way I want, and then I get access to all the presentations that have happened in AIS over the last so many years. And I'm pretty happy that the new person who has taken over this post is continuing the same thing in the same format. So it's a very good thing. Please visit the AIS website. And these are some of the other websites that I have been visiting from time to time. The Medscape, once you register, they keep sending you all the latest discussions, latest controversies, and all that. And so there are many such discussion forums that are, available. irounds.org. Like for every institute has a website. Every famous institute in USA, they have a website where all the stalwarts who writes textbooks, who are on the cutting edge, who discovers new things, they basically, talk in the website. There are webinars, and there are a lot of archived items. So, as you experiment online, you find that, a lot of useful websites are coming up. So this is basically, how education has improved. And now I don't really travel with any extra luggage. I have all these things available on my smartphone or my tablet, or when I go to the hotel in my, I can make presentations. So this is the way, after 3 decades as a cataract surgeon, as a practitioner, I have adapted to the environment, adapted to the world that is changing and helping me to keep, to stay on the cutting edge. Thank you very much for your kind attention.
Thank you, Dr. Arup, for a nice demonstration and bringing us this information to everyone, to the house.